No infection is more dreaded by the typical gym goer than athlete's foot. It's a fungal infection that affects the warm, wet regions between your toes. Imagine for a moment that instead of affecting your toes, this infection affected your lungs and your kidneys and your gut. This is the reality for frog species worldwide that are being decimated by a fungal infection called chytridiomycosis. Chytrid is a fungal infection of the keratinized skin, but the difference in frogs is that they use their skin to breathe, for fluid and electrolyte balance, and acid-base balance. Infection of their skin with chytrid causes them to lose regulation of these functions, with devastating effects. So if we go back to our gym goer with the athlete's foot, how do we treat him? Well, usually it's a short course of a topical antifungal applied to the affected skin. We don't have to worry about overdose because humans don't absorb much through the thick, hard skin on their feet. But again, in frogs, it's a different story. Their skin is thin and highly permeable. In fact, we can give frogs drugs simply by putting them in a bath of medication. The problem is that we don't know how permeable their skin is. We don't know if different skin regions exhibit differing permeabilities. And we also don't know how the chemical structure of a drug influences its absorption through the skin. My research seeks to answer these questions by creating a model of drug absorption through the skin of two frog species, green tree frog and the cane toad. These species were chosen in part because they have structurally different skin, and that could also affect the speed at which drugs pass through. The way that I investigate skin absorption is by taking a small sample of skin tissue and using the device that's in the middle, which is a Franz cell, I can actually quantify the rate and the extent of drug absorption from one side of the skin to the other. My results so far suggest that the differences in absorption can be quite significant and might mean the difference between therapeutic and toxic drug levels in these frogs. So for example, caffeine, which is the structure at the top there, when we apply it to green tree frog skin, it's absorbed 33 times faster through the ventral or tummy skin compared to the back skin. With the cane toads, we don't see any significant difference in region, and the rate is very, very similar to the rate that we see through the tummies of the green tree frogs. So what does this mean for our sick frogs when we want to treat them? Well, unfortunately, it's unlikely to be a case of one size fits all. It's likely that we're going to require different doses and maybe even different drugs to treat the same disease in different frog species. But by having a model, we'll be able to give drugs safely and effectively to frogs.